So, hi, my name is Marvin, and I'm working in healthcare for 9 years. I'm one of the quality analysts working in Accounts Receivable. I've handled multiple hospital based in United States. So, as of now, we're gonna discuss about HIPAA compliance. As we all know, if you are working in healthcare, HIPAA compliance is really important that we should follow it because there's a risk if you're not able to follow the HIPAA. So what does the meaning of HIPAA? So HIPAA means Health Insurance Portability and Accountability Act. So what's the meaning of portability? So portability means protect health insurance coverage when workers change or lose jobs. And what is accountability? Accountability sets standards for electronic health data security and privacy. If we're going to move to the next slide, why is someone working in healthcare required to follow HIPAA? So HIPAA matters because of the following reasons. One is the patient trust. um, Patients share sensitive information, so the patient expecting it to stay private. So HIPAA enforces that expectations legally. The next one is the legal obligation. So violations carry stiff fines, criminal penalties, and reputational damage for individuals and organizations. So if you're working in healthcare, you should follow HIPAA compliance, not just to violate law, but also to have confidence um, with the doctors or the organizations that you are working with. Making sure that you are able to keep personal or medical records that includes the patient information. So moving on to the next slide. So PHI, so there's what we call PHI. So for PHI, it applies to format of paper, verbal communications, electronic copy. So patients' rights under the privacy rule, access and obtain copies of their health records, request corrections to inaccurate data, receive an accounting of disclosures, request restrictions on a certain uses. So PHI is included the demographics, the health data, financial information, and then the biometrics. Those are information that you should not disclose to anyone via paper, electronic copies, or verbal communications. So this is really important that you should have keep it private. That's for the demographics. That includes the name, the first and last name of the patients, the address, the dates, the phone number, the email address, the social security number. For health data, you should make sure to keep the medical records. Anyone in your family, if you're working at home, uh, you should you should not see by anyone. You should have keep it private. And if you're working in the office, you need to make sure to lock your PC if you're going to somewhere else, just to make sure that you are following the HIPAA compliance. And then moving on to the next slide. So for the security rule, there is what we call the three safeguard categories. So for administrative safeguards, um, this is the someone who is working in healthcare. You are the one who make sure to keep the um, medical records or patient information in private. And then the physical safeguard, this is where you are working with. If you're working at home, you're working in hospital, or if you are working on site. So you should have followed the physical safeguards. And then for the technical safeguards, this is like more on your credentials. So if you're logging into your credentials, you should have followed the password requiremements. You should have follow all technical safeguards. And then for constitution of breach. So a breach is any impermissible use or disclosures of PHI that compromises security or privacy. Not every incident qualifies. Certain exceptions apply when risk is demonstrable. So we would like to avoid this one in case that you might violate breach to your company or if you are working as individual. So for this one, common breaches that happen if you're working in healthcare. So sending an EOB to the wrong patient address. So you should have confirmed prior of sending the EOB. You should have confirmed all of the necessary information before sending the EOB, such as first and last name, the date of birth, the date of service, the address of the customer. You should have confirmed all of that information. And then emailing a claim summary to an unverified recipient. So for emailing, you should have confirmed the right email address based on the uh, personal information of the customer, or if any email address on EMR tool that we have, you should have confirmed that on our system prior of sending email to recipient. And then unauthorized staff accessing a patient account. So this one is really important. If you are working at home, you should have um, lock your PC um, just to make sure that no one else is going to see what you're working with. If you're working at office, make sure not to disclose any personal informations or medical records to your colleague. And then moving on. So common HIPAA violations and billing RCM. First one is accessing records without need. So if you are working and one specific claims, so you should focus on that claim. You should not accessing any records that's not relevant to the claim that you are working with. And then improper fax or email transmissions. So sending super bill, claim, or remittance advice to the wrong number or or address. So you should always verify recipient details before transmitting PHI. Also sharing login credentials. So if you're working at office or working at home, you should not allow anyone to access your workstations just to maintain HIPAA compliance. Leaving screen unattended if you're going out, make sure to lock your PC, including with a password on your PC. Just to make sure to follow HIPAA compliance.